5 suitcases are, for the most part, filled with supplies for Guyana. The longest time I've ever been there before is 2 weeks. And even though I've been there 25 times, most of them have been a week, 10 days, 2 weeks at the most. So this one is essentially going to be there for the most part for over 4 months.
Dr. Deborah Isaac is on a mission. Guyana is a small third-world nation on the north coast of South America. Population 800,000, mostly of Caribbean and East Indian heritage, mostly poor, with an unusually high rate of heart disease, especially among children.
Like when she smiles, when she calls for mom and dad, and she eats, she always smiles, and when she eating, she dancing. That's what I love about her. She is everything to me, close to me. She's very close.
Chandra Day is just one of the children whose life is in danger without modern medicine.
Let's see if we can measure her oxygen here. When I first saw her in May, her oxygen saturation was sort of 45. We want it to be close to 100%. When I saw her in November, it was 31%. Personally, I'd never actually seen anybody alive with an oxygen level that low. The Guyana project started actually in November of 2011, and a colleague of mine who is originally from Guyana, he came around to my office one day and said, you know, Deb, I'm really trying to do something in Guyana to help advance heart care there. But he identified that many times the patients who were sent for surgery actually hadn't had the right testing done, and it turned out that they weren't being sent for what was really wrong with them. And nobody has the resources there to do anything about that, or the education. If you build it, they will come. So all of a sudden, we have a lot of patients. It seemed sort of random who was getting the echoes done. I always take a look at the piles that aren't yet done. And I'll see some that, oh, that patient was in the hospital. One of the people down there that we've trained will say, oh yeah, they discharged the patient home. And I said, well, that was a week ago, why wasn't it done? Oh yeah, well, we phoned him 10 days later and his mom said he died. I'm like, what? You know, so A, why were they sent home? And B, we have to prioritize these patients. Every once in a while I come across somebody I name that I go, I remember that name. What were we supposed to do with that child? It definitely keeps me up at night.
Dr. Isaac and her husband, Wayne Warnica, are both cardiologists based in Calgary. They've recruited a team of medical volunteers, doctors, echo technicians, surgical nurses, and medical students to bring equipment, training, and high-end medical care to these people in desperate need.
We went down with a little portable echo machine called the V-Scan and had a look at the hospital. And her first reaction was, oh my God, because there was really nothing there to base a program on. They had a lot of machines in the back room that were sitting gathering dust.
Aiming for 18 to 20 surgeries in the operating room in the first 2 weeks of March. It is a totally ridiculous amount of surgery to do in 2 weeks' time.
The Calgary mission has teamed with other doctors from around the world to perform surgeries. Dr. Rodrigo Soto is from Chile.
With Dr. Soto coming down there, because it has to be done in this period of time, he just works nonstop.
Because we're in a limited period of time for 2 weeks, we try to get the most of it.
I've been sleeping like 3 or 4 hours a day.
The thing that keeps you going is first of all, the adrenaline. You know, there's so much adrenaline in everything that we're doing. And you get really motivated because you know that we're here, we need to do as much as we can, help as many kids as we can. Any relatively urgent patient that we're not able to help these 2 weeks, we don't know if we will see that patient in the next trip. And that is like, you know, it's heartbreaking.
Chandra Day's surgery could prolong her life for decades, but it was still a nerve-wracking wait for her mother through the operation.
You are in an underdeveloped country, having a very tough life. You know, most of the people just survive, right? And having a chronic disease in that environment is 10 times harder. Having a congenital heart disease or being in cardiac failure is like running the marathon every single day.
Only 20% of children born with heart disease on the planet have access to proper care. 80%, 4 in every 5, have no access.
I do 2 hours of teaching with the medical residents via video conference every week. We're developing a cadre of young physicians who know how to interpret electrocardiograms and use that to treat people better.
It started off by something that was interesting and maybe would broaden my experience a little bit more. And some people would say now it's become an obsession. And damn it, I'm gonna see it through and do as much as I can. There are lots of frustrating times, but I think overall, with the support of everybody and the teams that I built up, I don't think we can stop now.
And now, since he did the surgery, she's pink. And I'm so happy because I never expected her to be so pink, and it's like a miracle.
Thanks to the dedicated volunteers of the Guyana Project, Chandra Day and dozens of other children are now home, looking forward to a bright future. But there is still much work to be done.
And she played with a little puchu-puchu.